Okay, hello everyone, and welcome to today's webinar. My name is Leah Ashragi, and I am the Senior Director of Clinical Research at Dr. Susan Love Foundation for Breast Cancer Research. For those of you who are joining us for the first time, I'd like to take an opportunity to introduce you to our organization. Dr. Susan Love Foundation challenges the status quo to end breast cancer through innovative research and improve the lives of people impacted through education and advocacy. We drive collaborative, cutting edge research with non-traditional partners, shed light on the collateral damage of treatment, and actively seek ways to diminish it and interpret science to empower breast cancer patients. Many of the projects the foundation undertakes are designed to increase our understanding of the human breast, where breast cancer starts and what enables malignancy to occur, with the ultimate goal of developing methods to prevent it in the first place. The foundation is also committed to participation in research that has the potential to positively impact the lives of all people who are at risk for or who have breast cancer. Breast cancer happens in people, so research needs to be done on human beings, and that means women, men, non binary people, everyone who gets breast cancer. Our Love Research Army is committed to encouraging and facilitating breast cancer research in all people, regardless of age, race, gender, sexual identity, with or without a breast cancer diagnosis. We are committed to thoughtfully engaging our members by providing them with ongoing, real-time access to an array of studies. Today's webinar is part of the Love Research Army study series, where we invite the researchers who recruit participants from the Army to present their findings to our community. We're very pleased today. Joining us are Doctors Karen Bazin-Enquist and Michael C. Robertson, presenting the results from their study titled Physical Activity Intervention in Breast Cancer Survivors. The purpose of this study was to finalize the development of an online exercise program for female breast cancer survivors that uses acceptance and mindfulness principles to encourage living a physically active, healthy lifestyle. The study was first shared with the Love Research Army on February 26, 2020, and the researchers closed enrollment on September 28, 2020. The study enrolled 120 participants, the majority of which were sourced through the Love Research Army. So thanks to all of you who are joining us today. Dr. Bazin-Enquist and Dr. Robertson will be available to answer questions from our viewers at the end of the webinar. So please submit your questions using the Q&A box. While we will try to answer as many questions as possible, please note that we may not be able to address every question today. So now I will turn things over to today's research team. Thank you, Dr. Robertson.
All right, thank you, Leah. Thank you, everybody. Good afternoon. So the name of the presentation here today is Developing and then Evaluating the Acceptability of an Electronically Delivered Acceptance and Mindfulness-Based Intervention to Increase Physical Activity in Breast Cancer Survivors. So the title's a mouthful, but it communicates the two main aims that I'll be presenting on today. So developing this kind of unique approach to physical activity promotion, and then evaluating its acceptability in the priority population in breast cancer survivors. So first, I'd like to acknowledge support I've received from my NCI F31 award that has made this research and the rich training I received along the way all possible. I'd also like to acknowledge the MD Anderson Center for Energy Balance, which has given me a professional home here through the years and enriched my education tremendously. So I really owe Dr. Bazin-Enquist and everyone at the center a debt of gratitude. Also, I'd like to acknowledge the Love Research Army, but we have our own slides for that a little bit later on. Okay, so first, the number of cancer survivors in the US is growing rapidly. This is due somewhat to a growing population, but also a relatively aging population and advances in early detection and successful treatment. So female breast cancer survivors make up over 15% of new cancer cases in the US, and female breast cancer survivors make up nearly a quarter of all survivors in the US today. So the take-home point here is that this priority population that we're looking to serve here consists of millions of people, and scalable solutions to serve this population are needed. So increases in survivability are certainly wonderful, but unfortunately, survivors still face serious challenges after completion of primary treatment. And these can include long-term health challenges, so the threat of cancer coming back, secondary cancers, all sorts of comorbidities, decreased physical functioning. but also these kind of quality of life related issues, these spade symptoms. So, sleep problems, pain, anxiety, depression, decreased energy or feelings of fatigue, and cognitive impairments. So, we need solutions for these issues that are contributing to so much suffering and spiraling healthcare costs. And again, given the millions of people afflicted here, we need scalable solutions. A wise person once told me that an ounce of prevention is worth a pound of cure. So, physical activity saves lives and protects health. It reduces the risk of many long term health challenges that I just kind of covered here, and also benefits people in the short term. It helps with many of those spade symptoms I just mentioned. So, in short, physically active individuals sleep better, feel better, and function better. So, breast cancer survivors will commonly cite the things that people in the general US population cite in terms of barriers to physical activity. So, things like just a lack of time, issues with the weather, lack of access to places to be physically active, lack of motivation, but they can also face barriers associated with the trauma, the mental and physical devastation of the disease and its treatment. So, things like cancer treatment related fatigue, fear of injury, physical limitation, pain, decreased physical functioning, and frustration about the new normal, the fact that things may just not be how they used to be. So, many of these issues are internal barriers. In many cases, there's simply no way to just plan and overcome them. Like if you wanted to beat the heat in South Texas, for example, there's ways to plan and overcome that, right? But some evidence indicates that when you have this attitude that some of these internal challenges are problems to overcome, so things like fatigue, fear, or pain, if you have this kind of attitude, then they can really tend to bounce back much stronger and actually make things worse. So, for these reasons and more, I think that existing approaches to physical activity promotion for breast cancer survivors are somewhat limited. And with this project, I wanted to really explore a new way, a novel kind of way to help increase physical activity. Acceptance and commitment therapy, or ACT for short, is a relatively new type of behavioral therapy that really acknowledges the fact that when you treat your own internal thoughts and feelings as if they were problems to be solved, this can actually be counterproductive. So, ACT instead is centered on building up your psychological flexibility. It encourages kind of a shift where you don't try to change your thoughts or feelings, you change your relationship with your thoughts and feelings. And it presents a toolkit for how to do so effectively. I'm kind of pressed for time here, so I'm not going to go into detail into all of these tools and processes. But for now, suffice it to say that ACT is centered on this notion of building up psychological flexibility, and it offers kind of a roadmap and various techniques for building up this capacity. Okay, so the study aims here are to, one, develop this active program, this new kind of novel approach to physical activity promotion for breast cancer survivors. And then two, to evaluate its acceptability in the priority population. So do breast cancer survivors care for this unique approach to physical activity? All right, so first we'll jump into the methods for that aim one, developing the intervention. This is kind of a busy slide, a lot going on here, but this kind of maps out the systematic approach that I took to creating this program. So I'll kind of break down this slide here. So first I started in the design cycle. So this is kind of the creation cycle. I created everything here. I started by referencing this Mindful Steps manual. So a key collaborator on this project had already done some great work for applying some of these techniques for physical activity promotion. I attended a good deal of training here in ACT myself, and then I created something that could be delivered electronically via something called a REDCap, which is just a survey delivery system. And it's a nice, secure way to privately interface with participants and deliver all of this content. So this intervention was centered on helping people to gradually work up to meet the nationally recommended guidelines for physical activity. So those are to engage in at least 150 minutes per week of moderate intensity aerobic physical activity, and to engage in muscle strengthening activity at least 2 times per week. So this is what we wanted people to gradually work towards. Okay, so I created this intervention here in the design cycle, and then we would go on over to the rigor cycle. where we would have this expert panel take a look at everything and provide feedback and let me know how we could make things better. So Dr. Bazinenquist was on this panel. We also had experts in ACT. We had experts in intervention or program kind of development. We had experts in technology. We had a breast medical oncologist on the team. And we also wanted to make sure that the voice of breast cancer survivors was included from the very start. We had 2 breast cancer survivors with considerable expertise themselves in conducting lifestyle interventions for other cancer survivors. So this team would take a look at everything I created, let me know, what they thought about it, how it could be better, let me know about safety. And it was really good to have this group of expert eyes here take a look at it. So they would give me their feedback. I would jump back into these design cycles where I would make revisions based on their feedback. And then we'd go on over to the relevance cycles where we'd have small groups of breast cancer survivors experience the active program and let me know what they thought. So for the participants, we recruited via the Love Research Army. I put forth a call to the Love Research Army and the Love Research Army answered. So I'll get into some of the numbers a little bit later on. It was almost overkill here. We were looking to just get small groups of people initially, and we had a lot of interest here. Again, I'll detail that a bit later on here. But the general design was we wanted to have small groups experience the active program, and then we administered surveys before and afterwards. And with those surveys, we were looking to, I'll also say that after the follow-up survey, I conducted individual interviews with everybody. So I wanted to get that kind of rich qualitative data just to touch base with people, let me know what was working, what wasn't working, how relevant this information, this unique approach to physical activity is, and how we could make things better. So again, we're looking to gather data here on the usability of this electronic program we're working on, and then also just the general relevance. To what degree is it resonating with the target population, with breast cancer survivors? Okay, so everything I've described here, that would be one wave. Okay, and then we'd restart the process. I would take the feedback from that I received in the relevance cycles, kind of revise everything, and then do the whole thing again. So that would be one wave, and I would continue this until I kind of got the green light from the expert panel that it's probably ready to move on to that next study aim. And I wanted to make sure I interviewed at least 12 participants. Okay, so I'll jump into the results here now for this aim 1. Okay, so in the end, we conducted 3 waves, and each of those is a column here. So first, we recruited 8 participants in wave 1. 3 were non-responsive, so they ended up kind of just dropping out of the study by not continuing to participate. And so I got interviews with 5 participants. The next, we recruited 8 participants, and in the end, got complete interviews from 4. And for the last wave, recruited 14 participants, got complete survey data from 9, and was able to touch base and do that follow-up interview with 7 participants. So the dates here are at the bottom. You can see that this project started, it's really underway here in March 2020. And we all know that in March 2020, we started seeing the use of the word unprecedented, this word being used a lot here. So this, I think, certainly had bearing. This showed up in individual interviews a lot. And I think it's noteworthy to point out that we were able to go on with this study, since it's totally electronically delivered and individual in nature, despite this kind of adverse historical event here. So I think that's really useful. It did probably have some bearing on the number of people who dropped out, but in the end, we were able to complete a successful study still. In terms of participant characteristics for this first aim, so we had the average age of about 58, a relatively well-educated sample. We saw that about almost 80% identified as non-Hispanic white, and most participants provided information that indicated that they had overweight or obesity at the time of the study. So I just wanted to kind of give viewers a sense for the look and feel of what we created here and how it looks as delivered via REDCap. So here we have the active program kind of design art, and we'll just kind of quickly go through just to give you the look and feel of things. This is one session that's centered on mindfulness. So we would start here with kind of a hopefully inspirational kind of quote. We'd always start with a kind of let's get focused mindfulness exercise to help bring the attention into the room or into the present moment. We check in about physical activity levels, so checking in about vigorous intensity, moderate intensity physical activity, muscle strengthening physical activity, always reminding people to please be gentle and kind with yourself and honor where you are in the journey. This is a marathon, not a sprint. Always want to gather information about kind of last week's program and see how that's occurring to people and what's showing up for them over the course of the week. We have kind of a progress bar here. We have a figure to kind of help integrate all of the concepts that we touch on in the program. Here's kind of the main lesson content. So first, what do you think mindfulness is? Here's various other definitions of it. And then there's a brief video. These are pretty common throughout the program. Try to keep them between 2 to 5 minutes long, so nice and short and sweet and down to earth, I hope. Reflections, constantly asking people to kind of take some of this, how does it relate to your life and what are you getting out of this? Here we have an extended mindfulness exercise, so an audio file here, more reflections, kind of just fun images and fun content here. And wrapping up with some not homework, but personal development work. So again, helping to try to usher some of these things into people's lives a little bit. Good quote here. And then greatest takeaway point. So what's one takeaway point? What's one nugget of wisdom here that came up for you that you might want to remember? These were presented to participants at the very end. And then also at the very end, we had here just optional extra resources. So just kind of threw the kitchen sink at it. People could go through this and pick and choose what they saw useful and valuable to them. So here's like a longer mindfulness exercise. Had yoga classes. So my wife has a PhD in cancer biology and also owns a yoga studio. So naturally, she kind of stole the show here from me, but no hard feelings. This was something some participants really loved. We had muscle strengthening exercises. I want to emphasize to listeners how great this resource is. So if you are interested in looking for muscle strengthening exercise videos, I recommend Googling the Penn State College of Medicine. Just type in Penn State College of Medicine exercise videos, and you'll find this resource. I'll detail this a little bit later on, but this is a really great resource for people who are looking to get a little stronger and do some muscle strengthening exercises from the comforts of their home and with guidance and insight from experts. Wrapping this up, participants wanted all of the links. They wanted all of this content to be able to take home for themselves and access whenever they wanted, gathering feedback here and then finishing up. So let's look at the data. So in order to evaluate the usability of this program, I administered the system usability score. This is a kind of fun instrument that's used for all sorts of different types of technologies here. Lots of data on it. In the end, the mean score was 80, which is very high. It falls within the excellent range that's been kind of set forth by other researchers. This is kind of fun here. We can see how the active program compares to other common technologies. So we see that the usability of the active program beats out the iPhone. So no big deal there, but we beat out the iPhone. Not quite as high as microwave ovens, which I admit are really usable, or the internet. So ultimately, this is really encouraging. Participants could use this successfully. And then in the interviews, we saw all sorts of themes here, 5 overarching themes, and I'll just kind of touch on some of these a little bit here. One theme was barriers to physical activity. So one thing is participants talked about experiencing this gap in guidance after completion of primary treatment. So this person says, she's really thankful that she survived, of course, but after the treatment, after some of the visits and some time, you're basically dismissed to go on living your life, and you kind of feel like, gee, what should I be doing? So participants said, something like this program could maybe help fill that gap in guidance after treatment. Again, people talked about these internal barriers. So this relatively young participant here is saying like, sometimes it's like when the hindbrain kicks in, it's like it doesn't matter when you start feeling down and whatever else, and you just want to be slightly depressed and curl up and not do anything at all. So participants really talked about how these internal barriers really can take away from their physical activity levels. All right, let's look at some of these kind of unique ACT principles or techniques for physical activity. So first, acceptance. So this notion here, it really resonated with a lot of people. This was a great success, I think. So this person says it, what I think articulates it really well. It was a different way of framing physical activity. Like, okay, yeah, it hurts, you're tired, or you don't want to do it, or you're lazy, or you'd rather play a game or something. That's what you're feeling. You don't have to fix it. You just have to acknowledge it and say, I'm going to do it anyway. Again, this person reiterates, knowing that it's okay if you can't fix these things. That was a big deal for her. So on to contact with the present moment, or these mindfulness type exercises. So for lots of participants, this was a great success. So this person talks about how when she's more mindful, she just seems to get more out of her walks. She's holding her head up high. She's enjoying the scenery. She's relaxing. Her stress hormones are subsiding. She's zenning. This was a struggle for some people. Some people didn't or had a hard time finding the time to kind of dedicate to literally trying to do nothing. And there's challenges to concentration that can be frustrating as well. So overall, I think it was a success. There's some things that we can work on smoothing out and making sure it's useful for more people. And then lastly here, this notion of values and goal setting. So a big part of this approach to physical activity is helping to build a bridge between what people actually care about and how they could do better and be more successful in engaging in their own values, by being more physically active and healthy. So it's kind of trying to build this bridge between people's personal values and physical activity. And for some, this was like readily apparent and this was motivating for them. So some people said that values encouraged me to keep moving forward and be active more. For some people, it was almost like it was fitting a square peg in a round hole. So some people said, it's hard. Some people said it makes a lot of sense and there's such potential there, but it didn't really register for them. It didn't really resonate. So I think this is one area we've identified there to be some potential, but we think there needs to be a bit more work here for connecting this more successfully. All right, and then just briefly onto digital considerations here. So you saw what I presented there, the kind of look and feel of the program. People liked the fact that there was like video and audio and text and just a whole bunch of different kind of short snippets here that could be appealing to different learning types and to drive home the messages in a way that was fun and engaging. And then again, I just want to highlight, this is what that website looks like, the Penn College of Medicine 1 team. Stands for Oncology, Nutrition, and Exercise. So these exercise videos, here's kind of what it looks like. Really phenomenal. It has partner workouts. It has workouts of the week. It has warm-ups, balance exercises, flexibility exercises, core exercise, lower body, upper body, all in these kind of short, accessible videos. Everything's made for cancer survivors from experts in this space. So again, I recommend people check that out if they're at all interested in this kind of thing. This 82-year-old woman loved those exercises. She says, I've gone to the gym. I hate the gym. I'm not an exerciser. When it says do a squat, do this, I had to go to the video every time to figure out what it was I was supposed to be doing. And the videos were good. So that's how I learned to do some of the things that I'm still huffing and puffing from because I did some this morning. So I did this interview well after the active program had completed. This was something that she incorporated into her regular lifestyle and was really feeling the benefits and enjoying. All right then, so let's move on to aim 2. Again, aim 2 is to evaluate the acceptability of this program. So do breast cancer survivors care for this approach to physical activity? So the general kind of design was that I had a larger group of participants experience the active program and then just administered surveys before and then after. Here I'm looking to get data on study retention. So to what degree are people staying in the study to the end? Study adherence, to what degree are people doing all of the sessions faithfully along the way? The usefulness of the program, the ease of using it, and then the enjoyment that people had while using it. And I also wanted to just explore to what degree the active program might be associated with changes in physical activity and changes in quality of life. Again, I put forth the call to the Love Research Army. The Love Research Army answered the call. So I think we just had to put out only 2 e-blasts and very rapidly got lots of interest, over 600 people in the midst of an ongoing pandemic. I was able to reach out and place a phone call to over 100 of those people, screened almost 100, went through the informed consent process with 82 individuals. 2 of them kind of dropped out right away, so they're not included in the analysis here. 3 of them were included, did receive everything, but didn't engage, so they are included in the analysis. But in the end, 58 participants went all the way through and completed the follow-up. So well over the 30 that we were hoping to get. So again, the characteristics are pretty similar, about 58 years on average, relatively well-educated, just over 75% identifying as non-Hispanic white, and 72% indicating that they had overweight or obesity at the time of the study. Okay, so here's how we were gauging that acceptability. So first, study retention. I indicated that 58 participants went all the way through and completed everything, and this met our criteria we set forth at the beginning. Next, on to study adherence. Here's a little figure that kind of sums it up. So each participant here is one of these thin little lines here, one of these little horizontal lines. So on the x-axis here at the bottom here, we see which module or which session it was they received. So there was session 0, or like an introductory session, and then 8 main sessions, and the color indicates whether or not the participant completed that particular session. So stacked all on top of each other on the bottom here, we see most participants, or about half of participants, completed every single session the entire way through. And then besides that, we have kind of the classic stair step, which is pretty common for electronically delivered interventions. So overall, we see that this is mostly green, and this actually compares very favorably to other kinds of electronically delivered programs. And in the end, it met the criteria we set at the beginning. And then lastly, we were hoping to see at least an average score of 5 out of 7 for ease of use, usability, and enjoyability. So we'll jump into what the data look like here. So for ease of use, we see that the first example here, we'll just go through. So learning to access this program's content would be easy for me. We see that most participants, well over 50%, said that it was extremely likely that learning to access the program's content would be easy for them. So the mean score was 6.2, above 5, and this met the acceptability criteria. On to usefulness. So again, we see a great majority, so 82% indicated that it was at least slightly likely, slightly to extremely likely that they, for example, that using this program would help them to be more physically active. So again, this score here above 5 and met our acceptability criteria. And then lastly, the enjoyment scale here. So an example here would be, I enjoyed this program very much. And we see great majority, 74%, indicating it was more than just somewhat true that they enjoyed this program. Again, this met the acceptability criteria. All of these did. And so that is a great finding here. And also wanted to go on and look into these exploratory outcomes. So first, to what degree may this program be leading to increases in physical activity? So here is a nice figure that shows all of the data. It's beautiful to me here. I'll explain what I'm seeing at the beginning here, pre-intervention. Oops, go back. Pre-intervention, the average number of minutes per week of moderate to vigorous physical activity was about 36 minutes per week. And then afterwards, that average was 167 minutes per week. So again, remember, we're looking to work up to that 150 minutes per week criteria. So on average, people did so. We can see almost everybody increased their physical activity from before until afterwards. It's a great finding for us. And then same kind of story with muscle strengthening physical activity. Beforehand, most people engaged in 0 bouts of muscle strengthening physical activity in a typical week. Afterwards, most people engaged in 2 bouts per week. Again, this is meeting those nationally recommended guidelines, what we were hoping that people could strive towards. So this was a great finding. And then also onto quality of life measures. So we found that on average, participants felt less fatigue and slept better. So these are kind of clinically meaningful outcomes that we experienced, we saw here. And it's promising that people, it seems to have really registered and people seem to really be feeling the benefits of this program and of living a more physically active lifestyle. So in conclusion, we created the active program successfully. In interviews, participants appreciated this unique approach to physical activity. The survey data indicated that it was really highly rated as acceptable to this population, and it may also be associated with meaningful changes in health-related outcomes. So I'd just like to say thank you all. Thank you to this wonderful foundation that has made this research possible, and for the army of women who answered the call. None of this would be possible without you. And while hopefully everyone's a little bit more excited about physical activity here, maybe I can pass it off to the team. I understand we have a big event coming up, and it might be a good chance to work on some of that physical activity and just personal acceptance.
Thank you, Dr. Robertson. That was a fantastic presentation. I thought it was amazing to see the results from your work, and thank you for sharing. I am going to go into some questions that we have from the participants, and just a reminder that if anybody has any questions, please put them into the Q&A, and we'll be able to go through them that way. So one of the questions I had is actually something that another person had asked, and kind of what are the next steps? And so one of the questions from a participant is, how will you disseminate this program for cancer patients to use or to cancer centers throughout the country?
Great question. Okay, so first I'll talk about kind of next steps. So I presented the look and feel of the program. It was all delivered via REDCap, which is a nice, excellent, secure way to present things. But in the individual interviews, people said, what would take it to that next step? Kind of having that kind of more refined look and feel, maybe an app, maybe just things being polished up more, maybe a better design. So I think that's an important next step, is polishing and continuing to develop everything. Right now, in my postdoctoral studies here, I'm really looking into kind of this concept of gamification. So if you think about this program I've presented, there's a lot about these kind of acceptance and mindfulness-based techniques, and then there's physical activity. And I'd like to continue to integrate them a little bit more. And I think having some sort of game design can help to kind of bring these together. So it's not just going through mindfulness exercises, then going out for a walk. I'd like to help integrate those more. So I'm looking to develop this program by kind of continuing to integrate some of these concepts and technologies and approaches. So I'm continuing to develop this year, and then afterwards, I think I'd really like this to supplement physicians' physical activity counseling. So we know that when doctors are able to talk to survivors, it registers and resonates a little bit more. And there's so many things that have to be discussed there that physical activity counseling and the importance of that can kind of be pushed to the wayside. So I think it would be wonderful to be able to have a tool that is really empirically supported, that physicians can reference, and it can kind of supplement their physical activity counseling. So we'd really like to fill that kind of gap in guidance after completion of primary treatment. And I think developing a strong research base for a tool that physicians can easily prescribe would go a long way.
Excellent, thank you. Another question we have from the audience is, what is considered weight-bearing activity? And in terms of weighted exercise, is there a minimum weight to be using?
So I think it's hard to answer that question. I think maybe Dr. Bazinenquist can provide her thoughts here. In terms of this program, we know that generally speaking, physical activity is a safe thing to prescribe, generally speaking. And I, with this program, want to create something that is accessible to lots and lots of people. And so it's hard to come up with like the right physical activity prescription for individuals on an individual basis. I tried to provide a whole lot of resources that participants could go through and kind of pick and choose what works for them, and have people really kind of listen to their bodies. Um, so I think those muscle strengthening exercise videos I shared, there's a lot of guidance there. I think that could be really useful. And it's hard for me to kind of come up with general statements for what's appropriate, for people given their unique histories, I suppose.
Yeah, that makes sense.
And I could just jump in and add a few comments. So usually when we talk about weight bearing activity, we're talking about activities, physical activity or exercise in which the weight of your body is being borne on your feet, right? So we're talking about walking or jogging or things like that. That's different. Usually that's kind of more aerobic activity. When we talk about resistance training or weight training, we're talking about, lifting weights or using your own body weight to strengthen your muscles. And as far as that kind of training, if you're talking about working out with weights, it's generally recommended that you start with at a fairly low level of weight in order to prevent injury, and very gradually work your way up to more weight. So in a way, the answer to the question about how much weight is too little weight is like when you're starting very low is a good idea, and you just want to start low with something that maybe is a little bit, you feel some difficulty, some resistance in lifting, but you can do maybe 12 repetitions of that exercise without any problem, and then do that for a while and then build up the amount of weight.
Great.
I'll just add there, for yoga, that there's a general sense that yoga is a lot less strenuous, right? It may be weight bearing in that you're on your feet and you can, there's some poses that can, you're really doing muscle strengthening exercises there. In conversations, some people talked about how really useful chair yoga was. So, that would be the kind of yoga where it's not necessarily weight bearing, but just kind of starting small and just kind of going through movements that can be really gentle and really useful, and then really gradually working up to being on your feet and to carrying more weight.
Great, thank you. Okay, the next question is, how does 150 minutes of exercise a week decrease the recurrence rate of breast cancer, and what is the percentage?
So it's another good question. I'm kind of more of an expert, or I wouldn't say expert, but I'm more interested in behavior change. And I kind of rely on the epidemiologists and the and the other scientists to produce the recommendations for what we are looking to kind of support and disseminate. So the actual mechanisms for how it decreases, there's a lot. Maybe Dr. Bazanequist, I know you recently contributed to a publication here and certainly knows a lot more than I do, can speak to that a little bit. But I'll say that, yeah, my focus here is human behavior and the kind of biology that goes on the other side of that. I probably am not the person to consult for a question like that.
So I'll add a few comments there. So first of all, I just want to clarify that our evidence about reduce risk of breast cancer death with physical activity after diagnosis is all observational data. So we've learned about this through cohort studies, studies that follow women over time and compare those who are physically active versus those who are not, and look at the difference in survival after cancer or disease-free survival. And mostly those studies are comparing kind of the people at the highest level activity to the lowest level. And we see about a 38% reduction in risk of dying of breast cancer when comparing those two groups. So it's a little bit more difficult in that those kinds of studies to say very specifically like how many minutes, but 150 minutes, a week is associated with some decrease in risk. But we don't have that randomized clinical trial data to which is sort of our highest level of evidence to support that observational data at this point, because we just haven't been able to do those trials. It's not that there have been trials that have been negative, but we do see consistent evidence in cohort studies following women who've been diagnosed with breast cancer over time, showing a lower risk of cancer-related death.
Excellent, thank you. That's very helpful.
One thing I would like to add here is just the importance of self-compassion here. So we talked, Dr. Besenquist just mentioned, lots of the data we have are observational studies. The last thing on earth that I would want to contribute to is people feeling guilty for their particular diagnosis. If you were not active beforehand, there's no evidence, that your particular, diagnosis had anything to do with your particular, habits beforehand. So this is really useful to prescribe on a population level. But I want to emphasize here that there's chance involved in all of this. And I just want to really emphasize the importance of having self-compassion here and not beating yourself up for anything, because that's not what the science is saying.
Thank you. I think everyone appreciates that. We have another question and a comment. So what a great program. And the question is, any considerations on something like this with the metastatic breast cancer community?
Yeah, that's a great question. So we did have some metastatic breast cancer survivors here participate in this group. I remember recruiting them, and they were like genuinely surprised. They were really concerned that they were not going to be able to participate, and they were, and that was wonderful. I think I think the next step for me here is to kind of zoom in on the data a little bit and see, for what subgroups within these people we recruited, what subgroups are really enjoying this, what subgroups are really getting the most out of it. And I think that can help, help inform our decisions going forward. There wasn't a lot of metastatic cancer survivors here. So I think going forward, and that was one major lesson I'd say I'd learned here, is the importance of being really, really inclusive and really, really careful with our speech. I did include metastatic cancer survivors, but I think there was a little bit of miscommunication in the beginning there regarding the eligibility criteria. And so all that is to say, I think being really, really careful with language for recruiting participants going forward is a major take home, and then including, being as inclusive as humanly possible here in our studies. And so I think that, people who have a history of metastatic cancer diagnosis have gone through a different experience. And I think that they may have different takeaway points from this kind of program. There may be some things in here that are particularly useful, and I'd like to hone in on that. So I think going forward, we're just going to continue to zoom in on different groups, including metastatic cancer survivors, and try to serve them individually as best we can. I think with this kind of approach to physical activity promotion, this kind of program, we're able to cast a wide net and gather data from lots of different people. And I think that as our studies continue to get bigger and bigger, we'll be able to get better and better data as far as how we can serve different subgroups most effectively. So going forward, yeah, we'll keep them involved as much as we possibly can.
Excellent. Well, and I think this next question kind of fits in nicely with the different groups, because it's a question about, does the program address lymphedema concerns with exercise? So that would kind of be a new group to look at as well.
Yeah. So again, I provided lots of resources, and there's several resources for physical activity for individuals who've experienced or experiencing lymphedema. And so yeah, there's let's see, I forget the name of the official body, but they put forth recommendations that individuals with lymphedema engage in physical activity. And I put forth their position statement in the optional extra resources. And then again, those muscle strengthening exercise videos kind of address that and how to modify muscle strengthening exercises to help address those concerns. So again, I kind of just put the kitchen sink into the program here, and people could go through and pick out what worked for them. But in the future, I think I'd like to take more of a kind of personalized medicine approach where people indicate at the beginning their unique, diagnosis history, some of their treatments that they've gone through, and additional factors like, related to lymphedema. And then ideally, the program would be able to pick and kind of do some of the legwork itself and provide these resources in a more tailored fashion and say, here's some things that we think might be useful for you. Let's put you, let's find some support groups. Let's have you talk to the right experts. And I think that could be really, really useful. And it's pretty promising.
Excellent. Well, and there's a follow-up comment from someone a little bit later about another group in chemo-induced peripheral neuropathy, specifically in the feet. So that would be something that would kind of go along with the lines of the lymphedema in the various groups. So that's great. Excellent. So did you also think about incorporating diet and exercise into the program? So we've got the various components. Or is there a thought about adding anything else?
Long term, I'd love to. I'd love to do that. Diet is a lot more complex, right? And so I think ultimately later on, we'd like to weave in kind of experts in that domain. Physical activity is relatively straightforward. We talk about the importance of muscle strengthening physical activity, aerobic physical activity, of breaking up that sedentary time, and the official recommendations for diet are a lot more challenging to kind of navigate because everybody's different and it's just a lot more complex for me. So I'm trying to kind of work on these kind of ACT-based techniques for behavior change and for physical activity production or promotion. Later on, I think that's a really, it came up in the interviews a lot. It's a really exciting area. People, the survivors I talked to had lots of different opinions and suggestions. So there's a want there. And I think later on, once this develops a little bit more, I'd love to incorporate that. But for the time being, I think I have to stick to keeping it a little bit more simple.
That's understandable. So this question is specific to the pandemic. So how do you think the pandemic affected your results? Were people more interested in doing something or less?
Well, I think, it's hard to say overall. I think the dropout rate was a little bit higher than I'd like, although it still was okay. I attribute some of that dropout to people, going through really hard times here through the pandemic. I know a few participants indicated that was the case for them as they kind of dropped out. I think that I'll say, some of these techniques here, some of these ideas of acceptance and mindfulness really especially resonated with people since we were going through this really tumultuous and trying time. So I think some of these principles are not just useful for physical activity promotion, right? They're useful for anything that comes up almost throughout the course of one's day, including, this kind of disaster we're living through. So in the interviews, people talked about how this really helped them. It helped them to cope with some of the anxiety and some of the negative internal feelings that they were having as a result of the pandemic. But it's really hard. I think there's also good evidence to indicate that physical activity, generally speaking, has decreased as a result of the pandemic. So I think that it's pretty complex there. I think it's, in some cases, it's really taken away from people's motivation. I think maybe the study helped a little bit more for those who were able to continue to apply themselves to it and be a part of it. But there's some people for whom that was just not possible. There was too much going on.
Yeah. Well, and that goes into a question about kind of just the overall mental aspect of this program. And so the question is the meditation portion of that really addressing the mental aspect, and what is the hope in terms of accomplishing? What are you hoping to accomplish with that meditation? And is it just quieting the mind to feel better about yourself? I guess this person is a little bit, interested more in this mental aspect side of things.
Yeah, yeah. So generally, I think there's good evidence that when people really try to be more mindful during physical activity, it can make physical activity more enjoyable for them. Um, you know, and it can be a little counterproductive. I mean, with mindfulness techniques, as you develop your ability to be mindful and to kind of settle in the present moment, you there's an ability to kind of zoom in and zoom out, right? So some participants really talked about loving being able to like hone in on how their legs are feeling as they're walking. And so, in some cases, when they're doing muscle strengthening exercises, like kind of just watching and appreciating, like, yes, my legs are kind of burning right now, and reframing that so that it's not like a Mayday situation, but it's like something that's interesting that you can attend to and be present. Some people like to kind of zoom out a little bit and say, okay, I'm going through this physical activity. I'm not feeling so good, but you know what? I mean, look at the overall picture. Like 99% of my cells are functioning perfectly. They're perfectly healthy, are doing exactly what they're supposed to. And then just this little tiny part of me is kind of burning right now. And when I take a look back, I can kind of, have just an added sense of perspective here that helps put things into context a little bit more. So that's as it's all applied to physical activity. I think there's apart from just the application to physical activity, some of these techniques can really bleed over into other aspects of life in a positive way. But I guess we'll focus on the physical activity for now.
Excellent. Well, thank you so much, Dr. Robertson and Dr. Bazin-Enquist, for joining us today. I think it was a really fantastic discussion, and thank you everyone who had questions and joined us. I will talk to this slide here. We are doing a Move with Love event on May 15th, so very timely for the presentation today. I don't know if Dr. Love, if you have anything you want to add to the presentation today, or any comments or questions?
Well, I think it really is a great presentation, because many of the studies that we do, you can't sort of immediately apply to your life. And this is one where it's something easy we can all do and start moving so that we'll be ready to move with love on May 15th. I'll certainly be walking. And I hope everybody else will join me, if only virtually.
And this event, as Dr. Love said, 100% virtual, and you can join from anywhere in the world, and you can do any activity you want to do. So this is no longer a walk. This is no longer a run. This is doing any activity that you enjoy. So please, take a look at our website, and you're able to sign up on the website there and support our Move with Love. So if there are any questions that were not answered today, or anyone would like to get in touch with the foundation about the Love Research Army or any of our research initiatives, you can email us at info@drsusanloveresearch.org. And today's webinar has been recorded and will soon be posted to our website, which is linked in the chat box for your convenience. And I also want to encourage our viewers to visit our website if you are interested in learning more about the foundation or making a donation in support of our mission to end breast cancer. Your donation is a direct investment in our research initiatives, including the Love Research Army. So I thank you in advance for your participation. And thank you again, Dr. Robertson and Dr. Bazin-Enquist, for partnering with the Love Research Army for this study. I think we were all really happy that you guys had such a great experience. And I loved it when you said that you put the call out and the Love Research Army answered. And that is why we're here. So we're really happy to see that, and happy that all those people participated in your project. So thank you everyone for joining us today, and I hope everyone is staying safe and healthy.
Thank you so much.
Thank you.
Thank you. Take care.